Today we're going to be talking about airway management, which is the second step of our March algorithm. The two techniques that we're going to be talking about is the head tilt chin lift and the jaw thrust. The first one, head tilt chin lift, is performed on a casualty that does not have a suspected spinal injury. For the head tilt chin lift, you're going to want to position yourself to the side of your casualty. You want to place one hand on the casualty's forehead and apply firm backward pressure with the palm to tilt the casualty's head back. Using my other hand, I'm going to place 4 fingers along the bottom of the chin and use my thumb on the top of it. It's important to remember not to use the thumb to lift and keep the casualty's mouth completely closed. The best practice is to use the thumb to push the chin forward, helping open the mouth. When my casualty's mouth is open, I'm going to inspect it for any kind of lacerations, obstructions, broken teeth, burns, or swelling. If I see anything, I'm going to attempt to remove it. However, if I do not see anything, I am not going to do a blind finger sweep or put anything into the patient's mouth. After I do this procedure, I'm again going to do my look, listen, and feel. I'm looking towards the patient's feet, watching for rise and fall of the chest. You want to feel the patient's breath against your cheek. During this, you want to count the number of respirations for 15 seconds. At this point, if my casualty is breathing on their own, I'm going to place them in the recovery position. The second technique is the jaw thrust. For the jaw thrust, I want to position myself towards the head of the casualty. The purpose of the jaw thrust is to maintain spinal integrity. I'm going to use this technique on a casualty that has a suspected spinal or neck injury. When I'm doing the jaw thrust maneuver, I want to make sure I maintain a good C-spine control by placing my forearms along the side of the casualty's head. I'm going to get down next to the casualty and maintain positive control, ensuring that I don't rotate or move my casualty's spinal column or head. I'm then going to take my fingers and place them along the curvature of the patient's jawline, ensuring that I'm below the ears, and my thumbs are going to go on the patient's chin. I'm then going to lift up with my index fingers and push down with my thumbs. From this position, I'm then going to inspect the patient's mouth for any kind of lacerations, obstructions, broken teeth, burns, or swelling, and I'm going to do my look, listen, and feel technique. I'm looking down the patient's jaw, down to their feet. I'm inspecting for rise and fall of the chest, listening for any kind of breath sounds, and feeling the patient's breath against my cheek. I'm going to do this for 15 seconds. Again, if I see something in my casualty's mouth, I'm going to attempt to remove it. However, if I see nothing, I'm not going to do a blind finger sweep. When you're doing the jaw thrust and you suspect a spinal injury, do not put your casualty into the recovery position. Just leave them as you find them on a hard, flat surface and get further medical care from higher personnel. And document my care on a DD Form 1380.